Did you know that ovarian cancer is called the silent killer because 75% of women are diagnosed when it's already spread? Are you dismissing symptoms as normal aging or menopause when they could be your body's desperate cry for help? What if the bloating you blame on stress or the fatigue you attribute to hormones is actually something far more serious? Here's what most women don't realize. Menopause doesn't just bring hot flashes and mood swings. The hormonal changes during this transition actually increase your ovarian cancer risk. Years of estrogen exposure throughout your reproductive life, combined with the dramatic hormonal shifts of menopause, create a perfect storm for cellular changes that can lead to cancer. Women who use hormone replacement therapy face an even higher risk, as studies show that estrogen-only HRT can increase ovarian cancer risk by up to 30%. But here's the terrifying part. The symptoms your body sends during this vulnerable time are often dismissed as just another menopause side effect. Ovarian cancer is particularly insidious because its early symptoms mimic so many other conditions. Unlike breast cancer, which often presents with a clear lump, ovarian cancer whispers before it screams. The symptoms are subtle, vague, and easily attributed to stress, aging, digestive issues, or hormonal changes. This is why it's often called the silent killer, not because it doesn't give warning signs, but because those warning signs are so easily overlooked or misinterpreted. Today, we're counting down from 11 to 1, moving from the most commonly dismissed symptoms to the most critical warning pattern that every woman needs to recognize. We're going from subtle to unmistakable, and stick around because one reveals the most important pattern that could literally save your life. 11. Unexplained fatigue. That bone-deep exhaustion you keep blaming on stress or menopause could be your body fighting a battle you can't see. Ovarian cancer fatigue isn't just feeling tired after a long day, it's a crushing exhaustion that sleep doesn't fix and rest doesn't relieve. When cancer cells develop in your ovaries, they become energy vampires, stealing nutrients and oxygen from your healthy cells to fuel their rapid growth and division. This cellular theft leaves your muscles, brain, and organs struggling to function properly, resulting in overwhelming fatigue that affects every aspect of your daily life. The cancer also triggers your immune system to work overtime, which is incredibly draining on your body's resources. Many women in menopause attribute this fatigue to hormonal changes, sleep disruptions, or the stress of life transitions. However, cancer-related fatigue is typically more severe, persistent, and doesn't improve with adequate rest or lifestyle changes. If you're experiencing fatigue that's affecting your ability to work, exercise, or enjoy activities you used to love, and it's been going on for several weeks without improvement, this isn't something to dismiss as just another menopause symptom. 10. Changes in bowel habits. Your digestive system can be one of the first to signal that something's wrong in your pelvic area. Changes in bowel habits, such as new constipation, diarrhea, or alternating between both, can indicate that a growing tumor is pressing against your intestines and disrupting their normal function. You might notice that you're having bowel movements more or less frequently than usual, or that your stools have become harder, looser, or different in appearance than they used to be. Some women experience a feeling that their bowels aren't completely empty even after going to the bathroom, or they may have increased gas and bloating that doesn't seem related to what they've eaten. These changes occur because ovarian tumors can grow large enough to press against the colon or rectum, interfering with normal digestive processes. The tumor can also cause fluid buildup in the abdomen, which puts additional pressure on the intestines. During menopause, some women do experience digestive changes due to hormonal fluctuations, but persistent, unexplained changes in bowel habits that last more than a few weeks should be evaluated by a healthcare provider, especially if they're accompanied by other symptoms like pelvic pain or bloating. 9. Persistent back pain. Lower back pain that seems to come out of nowhere and doesn't respond to typical treatments could be a warning sign of ovarian cancer. This isn't the kind of back pain you get from lifting something heavy or sleeping in an awkward position. It's a persistent, nagging discomfort that doesn't seem to have an obvious cause. The pain occurs because growing ovarian tumors can press against nerves in your lower back and pelvis, or because fluid buildup in your abdomen puts pressure on your spine and surrounding muscles. Some women describe it as a constant ache or a feeling like something is pressing from the inside. The pain might worsen when you're lying down, sitting for long periods, or moving in certain ways. What makes this particularly concerning is that the pain often doesn't respond to over-the-counter pain relievers or typical back pain treatments like heat, ice, or gentle stretching. Because back pain is so common, especially as we age, it's easy to dismiss it as arthritis, muscle strain, or poor posture. However, if you're experiencing new, persistent back pain that doesn't seem related to any obvious cause and doesn't improve with rest or treatment, especially if it's accompanied by other symptoms, it's worth investigating further. 8. Unexplained weight loss. Losing weight without trying might initially seem like a blessing, but when it happens rapidly and without explanation, it can be a serious warning sign of ovarian cancer. This type of weight loss is often linked to a loss of appetite and feeling full quickly, both of which are common symptoms of ovarian cancer. As the cancer progresses, your body starts using enormous amounts of energy to fight the disease, which can lead to rapid weight loss even when you're eating normally. Cancer cells are metabolically active and consume large amounts of glucose and other nutrients, essentially starving your healthy cells. The cancer can also interfere with your body's ability to properly digest and absorb nutrients from food, leading to a decrease in both fat and muscle mass. Additionally, some ovarian cancers produce substances that increase your metabolic rate, causing you to burn calories faster than usual. Many women may initially welcome unexpected weight loss, especially if they've struggled with their weight in the past or are dealing with menopause-related weight gain. However, losing more than 5% of your body weight in a short period without trying is always concerning and should be evaluated by a healthcare provider immediately. 7. Menstrual changes or post-menopausal bleeding. For women who haven't yet gone through menopause, sudden changes in your menstrual cycle can be an early warning sign of ovarian cancer. These changes might include periods that become heavier or lighter than usual, cycles that become irregular or unpredictable, or bleeding between periods that wasn't there before. You might notice that your periods have become more painful, or that you're experiencing pelvic pain outside of your normal menstrual cycle. Some women may even experience a sudden stop in their periods, which can be particularly concerning if it's unexpected and not related to pregnancy or other obvious causes. For women who have already gone through menopause, any vaginal bleeding is a red flag that requires immediate medical attention. Post-menopausal bleeding can indicate that cancer is affecting the reproductive organs or disrupting normal hormonal balance. These changes occur because ovarian cancer can interfere with the normal production of hormones that regulate your menstrual cycle. The ovaries are responsible for producing estrogen and progesterone, and when cancer develops, it can disrupt this delicate hormonal balance. While menstrual changes can be caused by many factors, including stress, weight changes, thyroid problems, or the natural transition into menopause, persistent or unusual changes should always be taken seriously and evaluated by a healthcare provider. 6. Pain during intercourse. Pain during sexual activity, medically known as dyspareunia, can be a symptom of ovarian cancer that many women are reluctant to discuss with their healthcare providers. This pain is typically felt deep in the pelvis during intercourse and can range from mild discomfort to severe pain that makes sexual activity impossible. The pain occurs because ovarian tumors can press against organs in the pelvic area, including the vagina, cervix, and bladder, making intercourse uncomfortable or painful. As tumors grow, they can also cause the ovaries to become enlarged and more sensitive to pressure. Some women may experience pain not just during intercourse, but also during pelvic exams, or even when inserting tampons. The pain might be accompanied by a feeling of pressure or fullness in the pelvis. This symptom is often overlooked or attributed to other causes, such as vaginal dryness, hormonal changes related to menopause, infections, or relationship stress. However, if you're experiencing new, persistent pain during intercourse that doesn't seem to have an obvious cause and doesn't improve with typical treatments like lubricants or treating infections, it's important to discuss this with your healthcare provider. Don't let embarrassment prevent you from seeking help. This symptom could be providing crucial information about your health. Before we continue, if you are enjoying this video, give it a like. It tells YouTube to recommend it with more women. Subscribe or share with your friends that might need it. 5. Urgent or frequent urination. Suddenly finding yourself running to the bathroom more often than usual, or feeling an urgent need to urinate that seems to come out of nowhere, can be a sign that an ovarian tumor is pressing on your bladder. This happens because as ovarian tumors grow, they can reduce your bladder's capacity and make it feel full more quickly than normal. You might notice that you're going to the bathroom more frequently during the day, waking up multiple times at night to urinate, or feeling an urgent need to go, but then passing only a small amount of urine. Some women describe feeling like their bladder never completely empties, or they may experience a constant feeling of pressure in the pelvic area. The tumor can also interfere with the normal nerve signals between your bladder and brain, causing sudden, intense urges to urinate. While frequent urination can be caused by many other conditions, such as urinary tract infections, diabetes, or an overactive bladder, it's important to consider this symptom in the context of other changes in your body. Women often dismiss this symptom, especially if they've had children or are getting older, because these factors can contribute to changes in bladder function. However, if you notice a sudden and unexplained increase in the frequency or urgency of urination that persists for more than a few weeks, especially if it's accompanied by other symptoms like pelvic pain or bloating, it's worth discussing with your healthcare provider. 4. Difficulty eating or feeling full quickly. One of the most subtle but significant signs of ovarian cancer is a change in your eating patterns, specifically, difficulty eating normal amounts of food or feeling full after just a few bites. This symptom, called early satiety, occurs because growing ovarian tumors can press against your stomach and intestines, physically reducing the amount of space available for food. You might start a meal feeling hungry, but after eating just a small portion, you suddenly feel uncomfortably full, bloated, or even nauseous. This can lead to unintentional weight loss and nutritional deficiencies if it continues over time. The tumor can also cause fluid to accumulate in your abdomen, which takes up space and makes you feel full even when you haven't eaten. Some women notice that they can only eat small, frequent meals instead of their usual 3 larger meals per day. Others find that certain foods that they used to enjoy now make them feel sick or uncomfortable. Many women initially attribute this symptom to stress, aging, acid reflux, or changes in taste preferences related to menopause. However, if you consistently find yourself eating much less than usual and feeling full very quickly, especially if this change has developed over a few weeks or months, it's something that deserves medical attention. This symptom is particularly concerning when it's combined with unintentional weight loss or other symptoms on this list. 3. Pelvic or abdominal pain. Persistent pain in your pelvis or lower abdomen that doesn't seem to have a clear cause can be one of the most important early warning signs of ovarian cancer. This pain is different from the temporary cramping that some women experience during menstruation. It's more constant, doesn't follow a monthly cycle, and tends to worsen over time rather than coming and going. The pain can feel sharp, dull, achy, or like a constant pressure in your lower belly or pelvis. It might radiate to your lower back, thighs, or even up into your rib cage as the cancer progresses. This pain occurs because ovarian tumors grow and press against other organs in your abdomen, including your bladder, intestines, and the lining of your abdominal cavity. As the tumor gets larger, it can also stretch the ovary itself, which can be quite painful. Some women describe the sensation as feeling like something is pressing or pulling from the inside, or like having a constant stomachache that never goes away. The pain might worsen with movement, during bowel movements, or when your bladder is full. Unfortunately, because pelvic and abdominal pain can be symptoms of many other conditions, including irritable bowel syndrome, urinary tract infections, or digestive issues, it's often misdiagnosed or dismissed. However, if you're experiencing new, persistent pain in your pelvis or abdomen that lasts more than a few weeks and doesn't seem to be related to your menstrual cycle or other obvious causes, it's crucial to seek medical evaluation. 2. Abdominal bloating. Persistent abdominal bloating is one of the most common early symptoms of ovarian cancer, yet it's also one of the most frequently dismissed. This isn't the temporary bloating you might experience after eating a large meal or during certain times of your menstrual cycle. This is persistent swelling that doesn't go away and often gets progressively worse over time. The bloating occurs when ovarian cancer causes fluid to build up in your abdomen, a condition called ascites. This fluid accumulation can make your stomach feel tight, full, or noticeably larger than usual, and you might find that your clothes don't fit the same way around your waist. Some women describe feeling like they look pregnant or like they've gained weight only in their midsection. The bloating can be accompanied by a feeling of heaviness or pressure in your lower abdomen, and it might make it difficult to bend over or move comfortably. Unlike normal bloating, which typically comes and goes, cancer-related bloating tends to be constant and may worsen throughout the day. You might notice that your abdomen feels hard or firm to the touch rather than soft like normal bloating. Many women initially attribute this symptom to overeating, weight gain, digestive issues, or hormonal changes related to menopause. However, if you're experiencing persistent bloating that lasts for several weeks and doesn't seem to be related to your diet or menstrual cycle, especially if it's accompanied by other symptoms, this is something that should be evaluated by a healthcare provider immediately. 1. The combination pattern, multiple symptoms together. Here's the most critical thing every woman needs to understand. Ovarian cancer rarely announces itself with just one symptom. The most dangerous mistake women make is waiting for a single, obvious sign when the real warning comes from recognizing a pattern of multiple symptoms occurring together. When 2 or more of the symptoms we've discussed happen at the same time and persist for more than a few weeks, this is when you need to take immediate action. The combination that should send you to your doctor immediately includes persistent bloating plus pelvic pain, or feeling full quickly plus frequent urination, or unexplained fatigue plus changes in bowel habits. Research shows that women who experience a combination of these symptoms are much more likely to have ovarian cancer than those who experience just one symptom alone. The key is persistence. These symptoms don't come and go like they might with other conditions. They stick around, often getting gradually worse over time. Many women report that they knew something was wrong because they just didn't feel like themselves, but they couldn't pinpoint exactly what was different. Trust that instinct. Your body knows when something isn't right, and when multiple subtle symptoms combine into a pattern that persists for weeks, it's your body's way of sounding an alarm. Don't wait for the symptoms to become severe or obvious. By then, the cancer may have already spread. Early detection is everything with ovarian cancer, and recognizing this combination pattern could be what saves your life. If you've made it this far, congratulations. These 11 warning signs aren't just symptoms to worry about, they're tools for early detection that could save your life. Ovarian cancer is most treatable when caught early, with survival rates over 90% when detected in stage 1. But when it's caught late, that number drops dramatically. The difference between life and death often comes down to recognizing these subtle warning signs and taking action. Start paying attention to your body. Keep track of any persistent symptoms, especially when they occur together. Don't let anyone dismiss your concerns as just menopause or stress. You know your body better than anyone else. If you found this video helpful, give it a like. It tells YouTube to share it with more women who need this life-saving information. Subscribe for weekly videos on women's health, menopause, and strategies to protect yourself during this vulnerable time in your life. And comment below, which of these 11 warning signs surprised you the most? You've got this, your health is in your hands, and I'm here to guide you every step of the way.